Hello everyone, this is Yoshiko Yamaguchi from Kwassui Women's University, Japan. Thank you for inviting me as a keynote speaker in this international conference and also appreciating for the conference organizer and participants for holding this conference in such difficult time haven't finished COVID-19 pandemic. I'm so pleased to have an opportunity to present a part of our research in this international conference in webinar. Our research is focusing on nurses. Nurses are predominant healthcare workers in the world and delegated to the robust role of maintaining or promoting people's health. So nurses are important occupation to keep people's health status. However, the number of nurses are insufficient in the world. Many countries are facing a serious situation of deficit number of nurses. Therefore, we want to explore effective way how nurses to keep in their workplace. Before leaving work, employees often feel intention to leave work. Of course, not always. Therefore, numerous research have researched what factors are antecedent for nurses' intention to leave their profession or workplace. At first, job satisfaction. Job satisfaction was likely most researched regarding as important variables of nurse turnover. If nurses dissatisfied to their work, nurses feel intention to leave work were reported on numerous research work in the world. Next is job tenure. Many nurse researchers pointed out that newly graduated nurses feel more intention to leave work than nurses who have long job tenure. One possible reason is that the newly graduate nurses do not gain enough skill or knowledge working as a nurse. Therefore, new nurses feel more work-related stress than they perceive intention to leave work. Next is organizational commitment. This factor was especially related to nurses' intention to leave their organization rather than profession. Nursing. If nurses don't like their organization or don't want to contribute to their organization, nurses feel intention to leave their work. And next is job control. Job control is a freedom for nurses on clinical practice. If nurses are allowed to decide their care by themselves, or nurses can act what they want to do, nurses satisfy their nursing, then they intend to continue to work. Contrary, if nurses are restricted to their freedom of nursing care, their intention to leave work increases. And the next is supervisor or worker support. If nurses feel their supervisor or worker friendly or supportive, nurses feel comfortable, then they intend to leave work or decrease. These are not all reported antecedent, however, most of these are work-related factors. Then these two work-family perceptions have opposite impact to work or family status. Negative perception, work-family conflict have negative impact. So if someone's work-family conflict high, then if it continue, he or her mental health impaired or decide leaving work. On the other hand, positive perception, work-family arrangement have positive influence. If someone feels work-family arrangement, if it continues, he or her job or family satisfaction high, they feel happy in both domains. However, contrary to work-family conflict, which is negative perception, reported result related intention to leave work are inconsistent. Along the mentioning background, we generated the following study purpose. The purpose of this study is to clarify which factors have more impact to nurses' intention to leave their profession among their work engagement, work-family conflict, and work-family arrangement. Data were collected in a Kyushu district of Japan. We randomly selected hospitals, nursing homes, and home healthcare institutions in Kyushu, then asked them to give the permission conducting this study. Finally, 4 hospitals, 20 nursing homes, and 34 home healthcare institutions have agreed to attend our study. We analyzed total 533 valid questionnaires. We apply regression analysis to analyze the relation between independent variables, work engagement, work-family conflict, and work-family enrichment, and dependent variables, target nurses' intention to leave the profession. This is result. Both work engagement and work-family conflict, work interference with family were associated to their intention to leave their profession. Work engagement was significantly negatively related to their intention to leave the profession. It means that if nurses feel more work engagement, they would perceive less intention to leave nursing. Contrary to work engagement, work-family conflict, work interference with family, not family interference with work, was significantly positively related to their intention to leave nursing. This means that if nurses feel more work-family conflict, they would consider leaving nursing. Different to work engagement and work-family conflict, work-family enrichment was not significantly related to their intention to leave the profession. Work engagement shows the most magnitude of impact effect to their intention to leave nursing. In this regression analysis, work engagement indicated about 4 times more T-score than the work-family conflict. Implication for practice. Ahead of it, this study have limitation, especially sampling. We conducted in one area of Kyushu in Japan, so this result might have contained characterized culture of Japan Kyushu district. From this study result, it is implied that if nurses love nursing, they feel bigger dedication and absorption for nursing. They may continue nursing with while adjust their work and family environment. This was simultaneously show if nurses who have less work engagement perceive work-family conflict, they will possibly feel more intention to leave nursing. Work engagement was the most effective for less nurses' intention to leave profession. It is shown that to make the job contents of nurse more attractive for nurses would be effective for less their intention to leave nursing. In future research, what job content is the attractive for nurses should be explored. This would be important for nurse retention in the future.